Hi there, everybody. Thank you so much for joining me again. We are going to be here with Dr. Khan very soon. Again, we're going to be talking about breast implant illness. We got cut off last time, so I'm hoping that we keep it short and sweet so we get to do the entire show today. Hi, everybody. Hi. Thank you for joining us. We're running just a minute late. Of course, whenever I think we're going to get started on time, there's something fun that slows me down. Dr. Khan should be here any minute, and we're going to be talking to him today. If you missed our last live with him, then you are in luck because we get to talk to him again today. Hi, everybody. Hi, everybody. Thanks for joining on. Dr. Khan is absolutely generous with his time, and we in the breast implant illness community so appreciate him. He, like many other now plastic surgeons, are only doing explant surgeries. However, Dr. Khan only ever did one implant, and he'll tell you a little bit about that. He is just an amazing man, and I'm so happy to say and call him a friend. He is here to help us out. Hi, everybody. And if you have never seen one of my lives, I will introduce myself. My name is Darby. I have a group called Breast Implant Illness, Detox and Healing, and I actually started my group because I didn't know where to start, and I am a wellness coach, and I was a life coach, and I had no clue what my issues were. I had infertility issues that actually happened after having my daughter. I had been to tons and tons of different experts and couldn't figure out what was my problem, so I started figuring myself out. And I found that so many women that are dealing with breast implant illness didn't know where to start. So I have a group where we share information and what has worked for us and how to heal our bodies. So if you aren't in that group, hi everybody, thank you so much for jumping on. If you aren't in our group, please join Breast Implant Illness, Detox and Healing here on Facebook. Also, lemonadegroup.org is my nonprofit, and we have just joined together to help women that are men and women that are dealing with implant issues, not just breast implants. It's also IUDs and different implants, different devices that are backfiring on the body and giving autoimmune issues. Hi everybody. If you are joining us and you're not watching the live, please text it and let us know that you're watching the replay. Also, if you know somebody that you think should watch this video, please tag them and let them know that, hey, we're on live, or you're watching the replay, and jump on. And anybody that you think needs to know about breast implant illness information, this is the time. Dr. Khan is really awesome, and he's going to be here telling us, his take and also answering any of your questions. We should be seeing him soon. Let me see if I can join, add him on here. I'm going to see if I can add him. All right, we're still waiting on him. Give me 1 second. I'll be right back, and we're going to see if we can snag him. All right, here we go. Let's see. So I just sent him a little nudge, and let's see if he jumps on. So if you're in our group, too, for breast implant illness, let us know. Tag underneath and give us a comment. If you have a question that you want Dr. Khan to answer, please mention it in the comments. And if for some reason we don't get to your question, Dr. Khan is amazing. Like I said, he's very generous with his time. And I've been able to send him questions, and he said that he'll answer them in this live. So if we don't get to answer your questions, give me a message, and I will either send it over to him, or, if we have another live coming up, which, like I said, he's really great with that, he'll answer your questions then too. Hi, everybody. Thank you so much. We have a lot of people joining us today. I'm so excited, and I know we had a lot of people last time. At 33 minutes, we got cut off, and I actually did a live with my good friend Amanda, who is magical. She is my good friend who helps me with the breast implant illness group, and she is just such an amazing addition to the Lemonade group team, and I couldn't do any of that, start all that up without her. She was just such a founding member and awesome, and she's there in the group too, so if you have questions, she's always great to ask too. All right, everybody, thank you so much for joining us. Hi. All right, I'm going to try to grab Dr. Khan and see what what we're missing here. I will be right back with you. Lots more friends joining in. Hi, everybody. Please feel free to add your question for Dr. Khan here. And as soon as he jumps on, we will answer your question first. I have a couple coming up here, and I know he'll see all of those. We've tagged him here, so he'll be here in just a minute. So I want to tell you a little bit more information about our breast implant illness group. Recently, we have almost 4,000 members in less than 4 months, which is just amazing. And it kind of says, you know, that the breast implant illness detox is really needed, and that the community is so big. It's really amazing and sad to me to see how many women are dealing with all of these issues, but also really amazing that we can all join in together. Hi, everybody, and help each other out. It's a beautiful thing. I know that up until recently, I had a lot of members say that, you know, they didn't feel supported, or that they didn't have, you know, anyone helping them. Hi, everybody. Hi. You know, or just any doctors that really understood or believed in breast implant illness. So it's really a lovely thing to have all of these plastic surgeons coming forward and kind of saying, hey, you know, we're not going to do any more implants. We see the damage on the body. We see the autoimmune responses. We see the long-term damage. Hi, everybody. Hi. So that is really just such an attaboy to us. You know what I mean? It's just really nice to know, a good acknowledgement that, you know, that what we're dealing with is, you know, is a real issue. And that I have a couple people that say, you know, have asked me, does it affect everyone? And, you know, I don't speak for everyone, but, you know, talking to as many women as I do daily, I would have to say to some, you know, aspect, it does affect everyone. It does, in different ways. And sometimes it's slowly, so you don't always realize that it's an issue. So we have Dr. Khan. He's about to jump on here. We're going to add him in, and make sure that if you have any questions. Hi, Dr. Khan. Let's see. I'm trying to add you now. I hope it lets me. Yes, here we go. Let's see if it's going to add you on. Easy. Oh, it says I can't bring you on camera. So let's see what the problem is. We seem to always have some kind of fun hiccup. A live is never smooth. Let's see if we can add Dr. Khan. Let's see. Here we go. Hi, everybody. Thank you so much for joining. Hey. Oh, hi, Dr. Khan. You're sideways.
Okay, let me go ahead and turn this around just a second.
I'm so sorry. You know, sometimes it works for me, sometimes it doesn't, but you're doing it right. You did it right.
Sure. You know, for the record, is this better?
Oh, I lost you for a second. Yeah, much better. And you have your headset too, right?
Yes. Everything is
Yay.
good. And
yes.
Much smoother than last time. So from the way I understand, we have 30 minutes. So hopefully we can answer some questions.
Yes, we have. It feels like we have about 30 minutes. Last time it was 33 minutes. And the time before that, when I was with Amanda, it was also 30 minutes. So I feel like it doesn't go any further than that. We have a lot of people jumping on now, and everyone very excited to get their questions going from you. I know a couple people asked last time, and I didn't get the questions until after we got cut off. I will ask, there was a couple questions that came up that I remember from last time, and I will offer them now. Did we lose you? There you are.
No, I'm basically setting this up so my hands are free. Just 1 second, please bear with me.
Sure.
Okay, so I got it. Last time I was actually holding it with my hand. So.
Oh my goodness, bless you.
So.
Hi, ladies. Thank you. I see you all joining. If you have a question, please message it underneath, and we'll see it as it's going. So there was a couple questions that I'll just throw out at you. A few of them I sent over to you, and as I mentioned, you know, I get a couple minutes to ramp up while we're waiting on you. Is just that you're so generous with your time. We so appreciate you. And it's such a lovely, it's such a lovely thing to have, you know, a doctor that feels like they're on our side. So we're so grateful for you to be here answering questions. One of the questions that I know someone asked is, there's an issue with the breast implants that they have platinum in them, and it's starting to damage what we found. And a couple, you know, me personally, and about 4 or 5 other women that I spoke to in the last 3 weeks said that they're having neurological issues because of the platinum in the implants. And I wanted to find out if you have found anything like this, or if you've seen anything, or what you think about that.
Sure. So, there are so many. Good evening, everyone. It's a pleasure to be back with Darby. I will tell you, I'm privileged and blessed to have had the knowledge and understanding, and whatever I can do as a physician to help understand and make this world a better place. So, if you look at the composition of the implants, it's made up of so many different chemicals. If you see on some of the Facebook feeds, and
Yeah.
the
Scary
composition, it
stuff, some
is,
of it.
yeah. And so half of the chemicals, to be honest, I don't even know of. So platinum amongst the many, many others. And you can see silicone, where it is made, how it's refined. So I, as a biochemist, I do not know how and physiologically how the pathologists are able to quantify. Now, I work out of the Providence Accession Healthcare System, which is a major hospital here in the Detroit suburbs, one of the nicest and the finer hospitals. And so they have like an army of pathologists, meaning like a big department. You don't have like two or three, but you have a huge, probably like 15 or 25 of them.
Wow,
And the
that's
point
nice.
being, yeah, so then they're able to, and it's a very good environment for them. So if one of the pathologists, and it's very typical and standard that if they are not able to determine or not sure, they always have a colleague of theirs weigh in and say, or sometimes they send the slides out to Mayo Clinic, which has one of the largest pathology departments, or maybe
Yes.
in DC. So to answer your question, I do not know how they're going to quantify it, because what they do is whenever I send the capsule off to pathology, they look at it, they basically refract light, they analyze it, they look at the histology by doing the many different stains, and then they determine as to what it is. Now, as far as them looking at and individualizing what the chemical grade is, I can assure you they're not going to look into platinum. And I do not know, to be honest, I'm not a pathologist, what exactly are the many different tests that many of the pathologists across the nation and across the world need to do in order to determine what they're looking for. Because it's interesting,
Right.
I call it one of the pathologists who said that they refracted light onto the capsule and they determined that this is polarizable and consistent with silica. The next
I remember
pathologist
that.
who read it, yeah, so the next pathologist who read it did not polarize the light. And I actually called him up and I said, "Can you do that?" And he said, "Well, am I supposed to?" And
Wow.
so there needs to be an understanding among the pathologists, just like amongst the plastic surgeons and amongst the rheumatologists and the
Right.
primary care doctors, that breast implant illness is very much real. These are the different studies that have been done. And they need to, amongst the pathologists themselves, group together and say, you know what, we need to be testing for platinum. We need to be testing not only for that, but maybe 10 other heavy metals or toxicities, so that hopefully one day there comes a time where they can do a blood draw right out of the arm and say, you know what, you have this floating around.
Well, this is very interesting. So, as you were saying that, it kind of made me think on my own personal journey. I've been teaching the doctors as I go what's going on with myself, because I'm a wellness coach. I'm not a doctor by any means, but because I have that interest, I've been researching everything that's gone wrong with me, and most of the women in my group do the same thing. So they're professionals on what's going on with them, and they've researched so extensively on what's going on with them. So it feels like, and just like breast implant illness, there's such a pushback from the community that this is real, that so many people have gone, so many, even my local doctors are going, okay, so this is real. But it's because of the pushback, and because I'm such a loudmouth and because I have such a strong force. Listen, this is what's going on, this is what's happening. And I would love it if platinum did get, you know noticed. It's one of the one metals that they agreed that, that the manufacturer are actually admitting is in the implant. There's a lot of other things that have not been admitted that are in there, even though there's a long list of all of these chemicals and all of these neurotoxins that are in there. And it seems, for me, I had metals that were out, off the charts, just terribly off the charts. I even had the lab call me, and they were trying to find out if I lived by some kind of, toxic wasteland, or if I was living off well water, because my metals were so high. And platinum is one of, it wasn't even something that was typically tested. But I had, neurological issues. I had numbness in my toes and fingers that I have nothing to do with diabetes or blood sugar issues. And I know a lot of women are having a similar problem. So really quick, you know, we'll cut to that since we don't really have an answer, but I know
Sure.
a lot of women were asking about that on the group also because
Sure.
metals
If
are such an issue.
lists that we
Sorry, go ahead.
deal with are the allergy and immunologists. So many of my patients, and I'm sure you are followers as well, and other patients with breast implant illness have gone to these allergy and immunology docs, and they do a whole series
Sure.
of tests, you know, basically on the arm. They basically inject and see what the body reacts to. And I
Right.
will tell you what's interesting is with breast implant illness, there is no true test that basically can diagnose. And so hopefully with the manufacturers and then the biochemists and the many other different like pathologists working together. Hopefully, they can come up with a test or a you know, a
Conglomerate
quick
of tests. Yeah.
exactly, so that we can look at the heavy metals because there's no doubt about it. I just look
No.
at the composition of silicon within the implant.
It's intense. Okay, so we have someone who did say they thought that they heard that platinum was related to depression and suicide. Sure, and suicide seems to be an issue with breast implant illness women, which is a sad, sad truth. And you know, Dr. Khan, you know that we've had some conversations about that.
Yes, no, it is very real because many people attribute it and say, well, this is the depression that the patient had with. But you know what's amazing is what is the proof that we have, or at least I have, and I will say I see it because I hear it from the nice ladies who are brave enough to post it and say, wow, all of a sudden, just from the explantation, a week later, I don't have those thoughts, ideations.
Yeah,
All of those are gone. And it's not one, two, there's hundreds and hundreds and tens of thousands
I
of these
know.
ladies. You know, what's interesting is one lady I just heard last week, she came to me post-op, and literally this is 2 days after the fact, and she said, you know what is one thing that I've noticed that I stopped doing, and I had never heard this before, but this is what the patient told me, and I listened to her. She said, I stopped biting my nails.
Wow, it was
And
the
I thought
anxiety.
that was
It was the
anxiety. And
anxiety.
I'll tell you this, you can, this is biting nails, especially with kids. It takes like reinforcement 10 times before the kid or the adult or whoever
We'll stop
it is
biting. Yeah.
will stop. And all of it. Now, she said that. I take her word for it. And I said, wow, I do not know. I've never heard this before, but guess what? I'm sharing with you. Now, the next person, maybe hopefully we have some listeners who can say, you know what? I stopped doing this, but
Yeah,
very
anxiety.
dramatic. It's a very dramatic bounce back from the previous state where patients have, as you and I know, literally gone into the woods, wrote their will, and said, you know what, to their
I'm out of here.
spouses, I'm
Yep.
not, yep, I'm not coming back, and not wanting to get out of bed, and literally detached from life.
I know. It's a sad truth. So there was I don't mean to transition so quickly from that sad story, but there was a couple questions, and I know we have a lot of people watching, and not everybody's asking their questions today. So I'm going to just ask you a few that I know a lot of people were asking. One of the issues that came up after our last interview, and you know, there was a lot of great feedback on it, and a lot of women actually agreed with the left side that we talked about, which was anecdotal, but I had so many people say, I can't believe it, I have a problem with my left side also, you know, after explant. But the issue that a lot of them were asking was, and we talked about it a little, was um, some of the women are feeling worse after explant. There's a small amount. And it came out in my group. I had someone say that there were some women that do feel terrible and they weren't mentioning it. And I made a really strong post about, if you're still feeling bad, this isn't something you keep a secret. No one is benefiting from pretending that you feel better. So you did mention that sometimes if you don't remove all of this, if you don't remove all of it, or the silica that can still be in the body, that made so much sense to me that you would still have all those autoimmune issues.
Right, absolutely. And just a little bit, a small amount is enough for the body to mount an immune response. And I will tell you, so we mentioned or we discussed the five things on the
Right. Yes.
review, which, what you need to be looking out for, just real quick again, for those who did not listen, the fact that the incision's got to be 10/11, otherwise you cannot do the end block. Number two, you need to get pictures to see that with the initials and the date that this was indeed you. Number three, you need to see the start time 8:30 and finish at 12:30 or so, 3.5 or 4 hours. Because I will tell you, as I do it, the way I do it, you cannot be doing it any faster. It virtually is impossible. Number four, that you want to have the implants back. Number five, you want to have a physician who has a reputation, like we talked about, Dr. Chan, Dr. Fang, and among the many others who are devoted to the point where they don't put in implants, because you can say with certainty these folks believe in breast implant illness
Right.
wholeheartedly, and they're fixated in removing the entire capsule. Now, just yesterday, and I'm going to have many of the patients, and this is where I say to each and every single listener, you have a check and balance on me, on the other plastic surgeons who are doing explants, to say that yes, indeed, it was done right. Because after some time, it gets very tiring. It becomes very, very absorbing, inclusively over
Nope.
time prove that you're doing it right, especially when you're putting in implants, because then you're truly not a believer. So I have, just from yesterday, a patient came in who's on the big website, and the many other websites are listed as an explant specialist.
Right.
This plastic surgeon is doing an end block plus a lift in 3 hours.
Hmm.
Right off the bat, that's a big red flag. And
You
I
mean you
say
don't
to
think she's
you,
getting all the scar tissue? So for anyone who's
if,
brand new to breast implant illness, what he's saying is, first of all, Dr. Khan removes implants. So I see a lot of new people jumping on here. So let me let you know, if you don't know who Dr. Khan is, he is a very well accredited surgeon, plastic surgeon. And what he does is he removes the implants, but he does it in a way that removes all the scar tissue. And he's saying that you cannot do it in less than 3 to 4 hours. And if you're doing other parts of the surgery in that amount of time, there's no way you're getting all of the scar tissue that also holds a lot of this potential silicone and silica and other elements, the scar tissue, correct?
scar tissue meaning the capsule, just so
Right,
that
the
patients
capsule, yes.
understand the terminology. Yeah, and this is another way to describe the capsule. So in order to tease off the pectoralis muscle is where is the top boundary, because 95% of the implants are placed below the muscle, which is the pectoralis.
Right.
And the lower boundary is basically the chest wall itself. And so the implant is literally plastered between the two. No, I will tell you, it is not a 20-minute process where you can dissect off of the pectoralis and off of the chest wall in a very thoughtful, systematic way. It is virtually impossible. And
Without disrupting
without
and allowing all of the chemicals that are inside to leach into the body.
to leak out, yes. And so I will tell you that is virtually impossible. And not only that, just to do a lift, for example, that itself, if I were to do a lift on a patient without any basically explantation, that in itself will take me 3 hours or so. So I will tell you right off the bat, and the patient knew better, that how can you do an end block and a lift at the same time in 3 hours?
Yeah,
Number
so
two,
not possible.
that virtually is impossible, and I'll tell you that's a big red flag. Now, I will tell you, the patient then said, well, the surgeon does not want to return the implants because the hospital's policy is they don't return implants, and I'll tell you that is not true.
I have heard that a few times. I had the choice, but I donated mine to research. But I did have the choice. But some women are saying that they're not even allowed to have it back at all.
So I will tell you, as a surgeon who's operating at a hospital, like for example the big hospital behind me, I dictate it's not dangerous to take implants home, by the way.
Okay,
It's
good.
not that you're going to be transferring like diseases, as long as it's cased basically in a protective,
As long as you're not swinging it
bag.
around.
Exactly, exactly. And but there are many patients, I tell them just wear the gloves. Remember, they were inside you, for God's
Right.
sake. If you cannot take him
Biohazard. Yeah.
home, yeah, yeah. If you cannot take him home, they were inside your chest. So that means this is not I will say justifiable. And if the committee, the operative committee, has an issue with that, you can certainly reason with them and say, you know what, this is the patient's right. At least have them hold it, with gloves, because they're not toxic. If you hold a cat like a, now if there is an abscess, for example, or there is, God forbid, mold or whatever,
Yeah.
yes, I understand. But there are containers that you can take this,
Mine was
or
in a
you can at
container.
least,
Yeah, mine
yeah.
was in a
And so it
biohazard
is
container.
very much safe. And I will tell you, it's not an indication to say, well, the hospital does not allow it,
Okay.
because you want to, as a
So now you
patient.
heard it here. You know that if you need your
I
implants, you can take them.
Yeah, because I will tell you, if the hospital denies, I will, basically have a discussion with the committee, and I'll tell them this is an important tool for them and an important aspect that the surgery was done right. Because if you don't get your saline implant back, for example, then I will tell you it was ruptured till proven otherwise. And
Right. And then
unfortunately,
that
that's the
way,
harsh reality.
okay, so there's that. So that's an answer to a lot of questions that I had in between our lives here, which was, why do I feel worse? If you didn't get your implants back and they refused to give them to you, there's a possibility they ruptured, which is why you feel worse. It could be part of it. And if that's a possibility, please let us know. Tina Hedrick, I see that you sent a question, but it was too long. It won't let me see the whole thing. So if you can give me a little bit of a shorter question, then I'll be able to answer, tell Dr. Conso he can answer it. And also, Raina said after she removed her explant, her desire to drink daily went away. And that's actually something that I hear a lot, as far, going back to the anxiety where you said the fingernail biting, is I hear that a lot, that a lot of women are saying that their anxiety is so intense that they're drinking, when they didn't know it was breast implant illness, or even when they did, that they were drinking heavily to try to offset this deep anxiety or depression that they were dealing with. And I must say that when my whole thing set in, I had a lot of anxiety. It was anxiety, and I was always a pretty relaxed person. I never really felt that way. And as soon as I removed my implants, I thought I had just had a baby when mine kind of kicked off, because I got pregnant and it disrupted, my breast swole and grew, and I breastfed, and I think that disrupted the implant, and I had terrible time breastfeeding. It was just a nightmare, and I thought I was having heart attacks. I was in the hospital 3 times thinking I had heart attacks while I was breastfeeding. It was miserable. And then after that, I had all kinds of infertile issues. I removed my implants after 2.5 years of trying for a second baby. I got pregnant in 4 weeks. And I had done a lot of detoxing in between. But as far as anxiety goes, I was just at the height of anxiety. I kept it a secret because I was afraid of how, it was very bad. And it's one thing that I hear from so many women, that anxiety. And now we have a ton of questions coming in. So let me tell you really quick.
Sure. Can I ask a very important question from last time? I remember looking at the Facebook feeds,
Yes.
like, why do you not make the incision through the nipple? So there's
Yes, that one. Yes.
four, yeah. So there's 4 reasons for that. Number one, the nipple itself. There are ducts around. Those ducts are not necessarily sterile, which means that they have bacteria in it, just like any ducts. So I say, number one, don't go into an area. Number one. Number two, majority of the times, 95%, 90% above the time, if done right, the implants need to be placed below the muscle. Below the muscle. So if you can imagine the anatomy where you're basically dissecting through the nipple, number one. Number two, you're going through the breast tissue itself. And number three, through the pectoralis. And then ultimately you reach the implant. Sure, it's a nice access, but you don't want to disturb the breast tissue itself and the ducts. So for example, if the ladies in their 20s and 30s are going to breastfeed, you don't want to disrupt those ducts, because you're only going to disrupt them in order to pull out, guess what, a 10 11 centimeter end block. And you cannot pull it out through a 3 or 4 centimeter incision. You don't want a big incision on your chest. That's number three. And
Okay.
number four, you don't want a scar on your chest. That is going to be very unsightly. And so the best way, and I like to tell others and my other plastic surgery colleagues, the inframemory at the inferior aspect of the breast is the best place. And last but not least, there is a lot of sensation to the nipple. You don't want to disturb that by cutting those nerves. And so that the post-op core nipple, which can be, I will tell you, it is not healthy, or it is not natural. You want to go ahead and reserve.
Okay, so Dr. Khan, I hate to interrupt you, but I know we're starting to run low on time and I have tons of questions who have just
Please.
come in.
Yes.
Okay, so first one is, do you find that high blood pressure is common with BII?
So it is not a correlation. Because what happens is, just imagine you have anxiety, then in itself is going to shoot the blood pressure up. You are basically had a restless night because of the back pain or the neck pain, or you feel horrible, or you feel
Or
frustrated
just
because you're not in
anxiety?
control, anxiety. So that will offshoot. But I will tell you, as a physician, as an MD, no one has millions of people have had breast implant illness, but it might just be coincidental because of the other signs, symptoms of breast implant illness that you're exhibiting. Some people have funny
Okay,
heartbeats, or some people are short of breath. A lot of women that I find and I talk to are get just basically walk like maybe a block, and the next thing you know, they're short of breath, that they have to take their breath. That in itself may make them anxious because they're not able to breathe well. And the next thing you know, the blood pressure and the pulse is going up.
that makes
Please.
sense to me. Raina, you have to give me your question a lot smaller. I'm sorry, it cuts me off when we're on a live, but I see a part of it. So, Summer, this answer is for you. She said that her explant took 2.5 hours and she's sad. She's feeling sick about it now. She said, how can she check to see if her toxins or capsule are gone? And is there anything she can do? She's 8 days post op now. And we did talk a little bit about the palpitating last time, and she's only 8 days out. So is there something she can do now?
Sure. So what I would do is there is swelling. The exams basically, the physical exam is not going to be much, meaning in a sense as far as being able to palpate. But let's say after the swelling subsets, maybe 3, 4, 5 months, if you feel a capsule that's hard indurated, like you see on the YouTube and the other videos, the hard shell of the capsule was left behind. Number two, you have the mammogram that will pick up on
An
calcifications within,
ultrasound, right?
and ultrasound like we talked about last time, and last but not least the MRI in itself will help us exactly determine the soft tissue masses if the capsule was, and last but not least, you know no plastic surgeon can say with absolute certainty 100% of the time I'm going to remove 100% of the capsule. So the surgeon needs to be upfront and say, I tried my best and I believe in breast implant illness and I went out of my way, and then I tried to remove the capsule off of the chest wall, and I felt from my experience and expertise that it was going to be too dangerous and there was a potential for a pneumothorax, which is air within the lung, which can be a medical emergency, which
And you
might
mentioned that
necessitate a chest tube.
before,
Yeah,
basically
so the
puncturing the
surgeon needs
lung
to
if
be
you get too
upfront.
deep in there.
Right. So the surgeon needs to be upfront and say, you know what, I removed 90%, or, there was some left behind and I had to bovie or cauterize, or I had to basically tease it off, and to basically confirm with the patient that this is basically what had happened. Ours,
All right. Um, so,
from the time you go into the operating room and before you even make the incision, I find I time myself, it takes me 20 minutes, 25 minutes just to do that, because you're prepping, draping, making sure everything is in order, the anesthesia is kicked in nicely, patient's very comfortable before you start. So basically 20 minutes just to kind of come out of the anesthesia phase and bring out of. So I will tell you, you always look at the reputation of the surgeon. That's very important and critical, because I will tell you, en bloc, myself, and I consider myself to be relatively fast in the sense that I'm not slow and I am not like where I'm trying to rush through. I take my time, regardless of however long it takes. If you run into how the capsule is adherent to the chest wall or to the pectoralis, and you take your sweet time in order to dissect it out. Surgery is involved. And to answer your question, you have imaging, and to an extent you have a clinical exam to determine, and last but not least the physicians or the surgeons words basically telling you that all of it was removed or not.
okay, that just reminded me of a question that someone messaged me yesterday. If they have cystic breasts and they've had an explant, how can they tell if there was still something left in the implant? Is it still good with the ultrasound? What would you say to that?
Right, so the ultrasound is very specific. If you look at the capsule, and it may have some irregularities, some inflamed tissue around, but you'll be able to pick out a wall that is present.
So
So
it will look like something still inside the body.
exactly,
Okay.
exactly. So if you can imagine, you have a water balloon or an IV bag, left, as an
And if it was
example.
only a part of it, what will it look like then? It just
So
like
it will
maybe a sheet?
it will show up as a foreign body type because it's not going to reflect the sound waves when they hit. It's going to bounce back and it will be a different density compared to the remaining tissue. It will be a very nice clear line if the capsule is left behind, or it might be irregularities because the capsule was removed in pieces.
Okay, that's good to know. So
And
before,
guess what? And guess what? If you look at your pictures post-op, you should be able to rule out the fact that the capsule, if you have an end block resection and you have a picture of you, your name, initials, and the date that the surgery was done, you know the capsule was removed.
good. Okay. So before we get cut off, because we know that could happen, tell us about your YouTube channel, the name of your YouTube channel, your website, and all that good stuff so that we have it right here before we get cut off, and then we can resume the questions.
Sure. So Khan, like my last name, Khan, Plastic Surgery Academy, Khan, Plastic Surgery Academy. My
And that's
website
your
is
is that your YouTube?
that's my YouTube
Okay,
channel,
good.
Khan, Plastic
And
Surgery
we'll share some of
Academy.
his videos on the group. We'll share some of his
Y-
videos on the group right
Yes,
after
and
this.
then yes, and then also executiveplasticsurgeon.com. And I say to everyone, use this. One of my friends basically called me up, and is a very close friend of mine from Philadelphia, and he said, "Well, you're putting your videos up, and it's pretty bold." And I said, "You know what? I am very happy to this process and discuss this with my patients, my other colleagues. Believe it or not,
You're helping so many people
yeah,
and you're giving so
medical
much
stu
hope. Yes.
yeah, medical students have looked at it, nursing students have looked at it, other plastic surgeons have looked at it, believe it or not, and other internal medicine, family medicine, primary care doctors have looked at it and say, what does truly end block mean? What I think from my experience, where I can step up and say, you know what, I feel very comfortable getting on and taking any question. Now, if I don't know, I will tell you I do not know. And I will tell you it is, I would say, it's a relatively, I would mention, a straightforward process, lack of a better word. When I use the word straightforward, that as you move forward, before you go in, and it starts from the history and the physical exam, what implant, when is saline, is it the gummy bear or the textured implant, what are the symptoms, should I get, if the patient has a history of breast cancer, and exactly,
Oh, we
sorry,
lost
I
you.
have these, no, no, I have these sensor lights. So
You're not
if
moving
I move
enough.
up, yep, 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 just 1 second. I'm gonna go ahead and move this just a
I
second.
have those in
So
my kids' room.
yeah, so here we go. So the point is, you want to use this as a tool so that, if you have a surgeon in Denmark or a surgeon in, South America or wherever, we can actually say, you know what, and maybe if
Share
someone can teach
information.
me, yeah, share. Because I will tell you, why do I remove the capsule? Because the capsule is bad, and we know this because of the pathology. Now, I did an explant last week. The pathology came back, and I can share that with you. It says no inflammation noted
That's
because the
amazing.
capsule was benign. The capsule was benign.
That's amazing.
And I'm going to send you a text picture of that. Now, I will tell you, there was another patient that called, and I remember we talked about last week when we were on last Wednesday. The patient called me and said, "Well, you did not remove the capsule." And I said, "Well," and I went in, the capsule was very much intact,
That's right.
and it was so soft and so benign looking. It was as if you just had the implants inserted. Now, I cannot remove the native breast tissue because I'm going to remove the volume.
Right.
Now, one of the other pictures that I just posted, it shows on the left breast a lot of soft tissue. And one of the patients commented, and that's a lot of soft tissue that you're removing because it's volume that you're taking away from the patient, because now you're going to have asymmetry. And I said, well, if you can just imagine looking at that picture, it is indurated, it is hard, and I do not know, it is not normal, healthy breast tissue. I don't want to leave that behind in the patient because next 6 months
Amen.
later, she gets a mammogram. God forbid,
Yeah.
that is basically a malignancy, is a ductal carcinoma in situ. I do not know. So as I go inside the chest wall, I'm able to palpate and feel the breast tissue, and I'm able to examine where I can, if I feel any abnormal masses, I will send that off to path. And I say this to you statistically, if I do 9 ladies, one of the 9 is going to have breast cancer on the table, because
Wow.
that is
And
a
can you
fact.
remove that while you're in there? Can you remove that?
Absolutely,
That's
absolutely,
so
absolutely.
amazing.
So I had a lady from Canada. So she came in and she said, I do not. So I almost all my patients, I always get microbiology, which is aerobic, anaerobic, and fungal. Now it adds a little bit of a cost to the whole operation, but I will tell you, it is one thing where you can feel and be comfortable that it is not mold, or it is
You
not
know
an
what's going on.
infection that
I
is
wish I would
hiding.
have
Yeah.
done it because later on I got testing done and I found out I had mold. I still had chemicals. I had basically everything, and I was breastfeeding, and it was a nightmare. And I don't even want to talk about it, but it was a nightmare.
Right, right. So
So
because it's so basically, as I go in, and if I find, and this is what the lady said, I do not want you to do my micro or my path. And I said, if I find any abnormal masses or any abscess or anything for the fact, I'm going to set it
yeah,
in. And she said, absolutely, because we don't want to be missing
that
out on
makes sense.
cancer.
Yeah,
Yeah, yeah.
I didn't have any of that, so maybe that was keep my
One
fingers
patient came
crossed.
to me. Yeah, one patient came to me. I gave her the implants back. They were in a nice container. And so she put them down in the basement. 3 weeks later, she called me and she was very, very anxious. She's like, wow, I opened the implants and there was mold on them. And I said,
Yeah.
guess what? Look at the final fungal report. It says no fungus, isolated, not on the stain. And this is, if you take a loaf of bread and put it down in the basement, come back 2 days later, you're going to find fungus growing. So
Okay.
that's
So,
exactly what happened. So that
whew.
was a reassurance for her. Guess what? It is not what it was. Another lady that I just did, believe it or not, she is, I'm going to be talking to her from California. She had mold in her basement, and now there is multiple lung issues going on. She's seen, and there's detoxification going on in
I
her
hear a
home.
lot
She's not.
about that. Yeah, well, I'm doing a
So
lot of detoxing for mold. We do a lot of that in our group. So there's a question whenever we're done. I just want to remember to ask you.
yes, so to the point being, I like to do that just to be complete, so that we don't want to come back and say, I wish we had done that, or I
Yes, I
wish
know because I
we.
wish I did. I wish I did.
Yeah.
So I'm someone here today saying, get your pathology because I'm wondering now what would I have seen, what would I have known right away that I would have handled before I got pregnant the next time instead of just guessing and thinking, what happened with me, and I'm almost 3 years since I've removed my implants, is as soon as I removed them, I thought, everything is fine and done. And that's not because the body holds, I had my implants for 10 years. That's a long time for the body to build up all of the things that happen as the autoimmune system is slowly tearing everything down. And your body, it gives it a lot of time to seep things in. So you have to give yourself time to detox. I meet some of these women who think they're going to detox in a week or a day, or they're taking some supplement and they think they're supposed to feel better in 2 days. And it's it's a marathon. It's not a sprint. You have to just give your body time to heal. So really quick. So this is something
Yes, please.
personal that, I've been working with breast implant illness women forever, and I've obviously been researching it forever. And so I like to share this information with you because I feel like maybe you'll have answers because of what you're seeing on the inside. Is a lot of the women, I get text messages from friends. I have a lot of friends who have dealt with implants, a lot of them that go back and forth. And the women that I see that have the most issues are the ones who replace their implants with gummy bear implants. And as soon as they had the gummy bear implants, I don't know if it was a difference or whatever's happening, they seem to have the worst symptoms. And I'm wondering if you see a correlation with symptoms from implant to implant, because I'm starting to see it from mentor to all the different types. I'm seeing different situations with each type that are with different symptomatic issues that are heightened with different implants. And I'm wondering if you're seeing the same thing.
So the no, this is all anecdotal, and I will tell
Sure.
you that now. I will tell you, I will give you, and we'll discuss with proof. So
Okay.
number one, fact number one, textured implants by far are notorious. So if you
Sure.
have from the
And we know
saline,
that.
which
We know that. Yeah.
yes, yes, and so that's why France stepped up and basically banned them, and then the U.S. Basically the Allergan, basically did a recall because the FDA asked them. The
Right.
textured implants are notorious and the worst of the group. Now, having said that, so there's ample studies. So if you look at the patients who have had the BIA, which is the breast implant associated ALCL, anaplastic large
Yes.
cell lymphoma,
That's
textured
the
implants by
cancer
far, yeah,
with the
that's the
textured.
cancer,
In case you're new,
lymphoma.
that's the cancer textured. Uh-huh.
Exactly. Thanks for clarifying, Darby. So these patients should now, what did they say? They said, well, if you have the textured implants, don't panic. It's okay. Well, I will tell you,
Don't
textured
panic.
implants. No, this is what, if you read what they said, in the news and in the official, statement that they put out, because as you can imagine, there's so many women
Well, they
that
don't want
have the
everyone
textured,
flooding in at once.
right,
Take
or
your
at all,
time.
or at all,
Slowly have cancer. Yeah.
right, or at all, because you cannot, it does not make sense. It's like one plus one is equal to two. Don't complicate life.
Sure.
And if you have textured implants, they specifically said, well, it's okay. It's so much rare, but the textured implants are notorious and by far the worst of all the implants.
The
Now, having
gel
said this,
cohesive, absolutely. And I remember telling my surgeon, no, I don't want those. I don't want those. And I remember him trying to sell them to me so hard. And I'm just so grateful. Now looking back, I remember he showed me the two different sides and it was cut in half and it was like a whole thing. It was like a whole thing. And I'm just, so many of my friends that have them, I feel so bad for them because their symptoms just shot through the roof. And that's the one that I hear the
right,
worst
right.
about.
Sure. Now, people say, and this is an unfortunate statement that people make, well, saline implants are safe because guess
Yeah,
what? And
no,
it's
that's
true.
what I
If you
had.
rupture, yeah, and so that's so saline implants are by far not safe either, because if you look at the tens of thousands of ladies who have had saline implants, they have the same
Well,
suicidal
the
ideations.
shell is still
The shell,
silicone.
exactly. And so they say, well, it's not a gummy bear. If it leaks, it's going to rupture. Guess what? That saline inside is also
It's still
not
going
the
to
same
touch the
saline.
body. Right.
Right. And so the point here is saline are bad and in the same category as bad. This is just like saying, I hate to use this as an example, well, you have 10 different cigarette manufacturers.
Sure.
Well, these Camel brands are the safest and good for you,
Yeah.
you cannot say that because all of them are in the same category of bad. And to the point where, and I use the word bad because number one, they're not meant to be there forever. They cause badness. They're cause a lot of, uh, as you know, the breast implant
Autoimmune
illness
issues.
associated
Right.
autoimmune issues, and eventually, and I'm going to say two facts, and I challenge anyone to basically contradict, and I tell almost all
Con
my patients this.
challenge number
Yes,
one.
yes, yes. So number one, all the ladies that I've taken care of, interestingly, and then also on social media, all of the ladies who have explanted and the ladies who have been on social media have explanted to other surgeons, none of them have said, I regret removing the
No, I
implants.
haven't had anyone say that they regret. Not one
So that's
person. Not
not
one.
single person. And you know
No.
what? Very interesting fact, because I myself have seen it. And number two, the same ladies, that my patients and the patients who, they all state another fact, which I always find interesting. I wish I never put them in. And number two, I wish I had taken them out sooner.
Sure.
And,
Me too. That's
yeah,
absolutely how
but
I
what,
felt about it. Absolutely.
yeah. So I find very interesting that, I have yet to meet that patient who called me up or comes back and says, I
And said, put them
regret,
back
can you,
in.
yeah,
Put them
yeah,
back
yeah,
in.
never. So if anything, and then I tell them, well, write about it, because that way you can at least tell the next
You can
20
help
year old,
somebody. Yeah.
24-year-old, because I will tell you, statistically speaking, someone who gets them in at 24, and this is why I, as a board certified ASPS plastic surgeon, I said, you know what, it's not worth it.
Sure.
Because if you're in your
What happened?
20s,
It could happen. What could happen?
what, right, what's number one, they're not meant to be forever. They have all these problems, as you can see. If someone told me that if you walk in on this road, you might get bit by a dog. Do you think I'm going to walk on that road?
Yeah, no,
Absolutely
thank you.
not. And this is the same thing. If you take the path of putting an implant, there is a chance that you might get all these breast implant illness
And
associated
we
problems.
have tons of young women who join the group just so we can talk them out of it. And I'm so grateful for that. And if you're
And I
thinking about
say,
getting implants, join Breast Implant
just
Illness Detox and
be
Healing.
and be an informed patient. That's what I'm
Right.
trying to say. Because this one lady said that, well, they were supposed to be in for 20 years, or they were not supposed to be any problems, or the other fact that, oh, you're going to look, how are you going to look after the explantation,
I
and
look
the
fine.
other many
I look
problems.
great. Yeah.
So at the end of the
Forget it.
day, I say, and I
I'm
say to
alive.
everyone, I say to everyone, it is not worth it. It is
No.
something that you don't want to take a path and then regret it, because that's what eventually everyone else does. It's just a matter of time. Some 20 years later, some 4 months later, some 40 years
Some,
later.
yeah. So
Yeah.
listen, we have tons of questions really quick. Okay. So first, Tina, I'm so sorry to hear that. She said her sister died from a rare T-cell non-Hodgkin's lymphoma with textured implants in 2009. That's terrible. So also, do you feel the longer that the implants are in, the longer it takes the body to heal? And yes, he does think en bloc is absolutely important. If you start the video from the beginning, Stacey, that's how you just jumped on. This video and the last video, he tells you why en bloc is absolutely necessary. So yes, I'll answer for
Sure.
him.
So that is a very good question, and I do not know the answer, because there are patients who have had them removed after 6 years, and they said and these are the ladies telling me that they love the imp worked for the patient. But after all of a sudden, overnight, when they got up, they started exhibiting these signs, symptoms, and 6 months went by, a year, and they did all the tests. They went to the emergency room so many times, and then all of a sudden, the sign symptoms kicked in. There's
Yeah.
another lady that came in, and yesterday she said, my sister has had them in, and she's fine, doing perfectly well.
I
There's
know
no
a
issues
few.
going
I
on.
know of 2 or 3 people that don't have any type of crazy symptoms, but they have some. So we have one more question really quick, and then we're going to wrap it up so that we don't end up getting cut off. But I do want to say I share Dr. Khan's videos also on my Crunchy Life, and it's Crunchy with an IE on all social media. I also have a podcast, My Crunchy Life, all one word, on iTunes and on Spotify. I'm also on YouTube and Instagram, and we talk about Dr. Khan, and I put a lot of his information up there too. And you can find him on YouTube as well. And I will link his YouTube to my YouTube tonight so that you can find him easy. And really quick, we have a few. So Stacy says her
Can I can
surgery.
I can I can I
Sure.
say, I saw Stacy's my surgeon
Yes,
says
good.
he will try to
That I
remove
was going to
all,
read
but
you
we're
that.
not. No, because I saw that and I said, Stacy, this is the excellent question, and if this is the take home message, this is the take home message. And I give the example of the, I'm going to try to go to the moon today, and if I'm not, that's fine, and I use that as an example, sarcastically, because you have to be believing in it wholeheartedly, like you mean it from your heart. And I say, and I use the example of those women who I've talked to, and I shared the same discussion. If I'm going to war, and I use the word that as an example, one free soldier is better than 10 hired ones, which basically means if you're going to fight from your heart, that you
Believe
believe
in
in
it.
it
Yeah.
to the point where you do not insert implants, I will tell you, the surgeon is fixated, determined, he's enthusiastic, he is committed, he's not backing off, he's trying from his heart, because God's watching, you're doing a job right, because you care for the patient to the point where you're not putting in implants. Now, I will tell
So
you, the
basically,
moment I
go to a
put,
surgeon that believes that he needs to remove all of that because he doesn't want you sick, not someone who just says, it's going to be all right.
and right, so this is another surgeon here in town, another lady surgeon here in town. Well, I'm going to try. If I get it out, I get it out. If I don't, it's okay, because I don't believe in breast implant illness,
And
because
there
it's not
are a
going to
couple
hurt you.
surgeons. There are a couple surgeons that think it's a load of hoo-ha. And
You know,
so there's people that are having a hard time getting in, or they're looking for a cheaper surgeon. And I say, listen, this is your body and your health. Do not go to a discount store. Go to the Neiman Marcus and get your money's worth, because this is your health. And if you have to go for a
then
second surgery, it's going to cost you so much more.
Right, right. You know, and I say this very openly, and I say this, and again, this is going to be echoed many times. It's important that you go to someone like, if I, for example, had made a recommendation to someone, I'm going to say, go to someone who believes in it wholeheartedly,
Someone who is
because
absolutely
absolutely
BI
committed.
behind BII, not putting implants in, he's saying.
And you know what? I will tell you, unfortunately, you cannot say I believe in breast implant illness and say I'm going to not talk about it on Facebook, or I'm not talking about it on YouTube, and I cannot publish, because that's another way I can add to my practice, if you will, more patients.
Yeah.
And I will tell you, you cannot pick and choose. You have to, because I will tell you, if I didn't believe in breast implant illness, do you think I'm going to leave, or I'm going to take out all of the capsule? And I will tell you, I would not, because
It's a lot of
for
work.
me, it's definitely a lot of
Yeah.
work. And I'll tell you, this is what I tell one of the patients asked, from the last, how do you take a break because you get so tired? And truly is very to be so focused, because if you're up a millimeter or a millimeter and a half, you can go directly into the capsule, puncture the saline implant or the silicone, or damage it, or release the
Wow.
contents. Or if you go down into the chest wall, you could indeed cause problems to the muscle and maybe a pneumothorax.
Gotta have a steady
And
hand, Dr. Khan.
yeah, and so that's why, I basically posted the video as to how I dissect in a bloodless plane, and how you have to really be committed, because you cannot be rushing through it in half an hour. It is virtually is you have to, like, for example, and look at these docs who are committed. You can see it in their eye. They believe in it wholeheartedly. You can see the sincerity that they're going about talking about it for the better of the ladies, because they want to help everyone, and they do not want to put in the implants. And I say, you know what? That is really outstanding, because you believe and are committed so wholeheartedly that you're not putting in implants. And so the point I'm trying to make here is that you have to go to someone, and your sixth sense should tell you that, if the surgeon says, well, I'm going to try, if not, I'm not going to sweat
If
it.
you walk
This
away
is
feeling
not,
weird, don't do it.
this is not the attitude that you have to have for this type of surgery, because I
Sure.
will tell you, I never want to sweat for something,
Yeah.
unless you're truly committed from your heart that you're going to do it, because you have honored the patient, that the patient is coming to see you, and you believe in it to the whole point. Because I will tell you, all what I said today, if I told you I put in one implant last week, or last year, or 2 years ago, or 4 years ago, all what I said went down the drain and goes down the drain,
Sure.
because
We're
all of a
kind of
sudden
scratching our
my
head going, oh,
right, right, right.
okay.
And so that's why I say, and to my respectful colleagues and plastic surgeons, yes, that is true. Plastic surgery has 3,000 operations. And I said, you know what? I'm going to be a real doc. I'm going to be a real surgeon, and I'm going to go help. If I find from my experience from 2003, and ever since I've been in surgery training, and then thereafter, I said, you know what? Why should I do something that's going to cause harm? Sure, it pays very well, by the way, but I'm not going to go commit to something that I don't feel comfortable doing, where I find that the patients ultimately, yeah, they may have a temporary benefit, but ultimately at the end of the day, I don't want to do something that's going to ultimately lead to unnecessary surgeries, which has been shown over and over, that
Amen.
someone in their, yeah, someone who gets to, just hypothetically speaking, someone in their mid 20s or early 20s gets an implant, correct? Statistically speaking, if the implants last 10 years, you're going to have changed the implant 6 times in their lifetime,
Wow.
statistically, and this is let alone all the problems, breast cancer, and the breast implant illness, and the other problems that they come in with. And I say this to the ladies, and I say this to the men, who are sometimes persuading the ladies to go one way or the other,
We
which
see
is a
you.
big, yep, yep. And I tell, there's three target audiences that I have. Number one, the ladies who have implants and who want them out. Number two, ladies who are interested in putting in implants and they just want to hear about breast implant illness. Hence, this is a very good discussion for them.
Sure.
And number three, I will say this, it's the significant others that compound the problem, where they push the patient over who might be reluctant and say, well, I want to look better, and this is what I'm going to do for him, and which I will say it's not. You need to be the boss. You need to make the decision, because at the end of the day, it's your body and you're going to have to be living with it day in and day out.
That's right. And so there's a lot of women that are having a hard time persuading their husband about breast implant illness. Show them this video. Tag them on this video. Send it to them privately. I'm going to be putting this video up on my YouTube channel so that it's always there, and you can take it from My Crunchy Life, Crunchy with an IE. And we're going to answer one more question, and then we have to wrap it up. I'm so happy we didn't get cut off, but I'm knocking on wood that we don't get cut off here. Okay, so the last question we're going to answer is, why are some capsules thin and some thick, and are they hard to remove? Are they both hard to remove?
So I will tell you, whenever I see a patient with a capsular contracture 3 or 4, my life, my job, because it's hard like a rock. I just elevate
So
it.
a 3 or 4, so it goes from 1 to 4. Is that the scale of how
correct.
thick it is?
So this is, yes. So Baker's classification is the way where we plastic surgeons have come up with terminology where someone in Japan or someone in South America can say Baker's 4 classification is where you have a chest where the capsular contracture is so
thick,
hard, and thick, where you actually not have a distortion of the chest wall from a distance.
And I've seen that. A couple of my friends have that, where they get that really strong rippling.
Right. And then you can see even thumbs up or deformed chest, and that grade 4 tells us that this is pain at rest. So the patient is sitting down, just breathing normally, let's say, and they have pain at rest because it's so hard and compressing against the chest wall. I wonder if
insurance would be more likely to pay for that.
So, that's an insurance-based question. I will tell you, they
just
always
thinking out loud.
Yeah, they say, cosmetic in, cosmetic out. They say,
except
well, if
that
you
when
got a
they
face
take them out, it's for health reasons. And I actually had someone tell their insurance that, and they took it out and they paid for it. They said, I would not be removing these for cosmetic reasons. And it was like, well, I can't fight that.
This is a very good question. And I say the only way you're going to find out is you submit all the paperwork to the insurance, and you show that you have an MRI that's ruptured, and you basically go to them, and the insurances have criteria where they say, well, if you have a ruptured implant, you have a grade 3 or sometimes even grade 4. Even if you submit, they almost always end up denying. But I will tell you, you're not going to find out till you actually submit the paperwork and you let the patients process this. And I tell them, get the letter from your emergency room visits, from your primary, all the signs, symptoms that you're living with, because you
put them all in a package.
Make the file thick, and you let them know, this is what I'm going through. This is breast implant illnesses. This is what is real, so that it becomes a recognized entity, and that there is an ICD-10 code, which means it gets recognized as a disease or a phenomenon that is true and real, and it's not. So that is very important for you to do in order to basically submit. Now, I will tell you, of all the ones that we have submitted, the insurance companies have turned around and then they have declined, unfortunately, because they say, well, the examining and the reason.
It might be changing. That might be changing. Every day is a new day with this kind of stuff.
Allergan just pull the textured implants off the market. You would think they would say, okay, we're going to pay for the ladies who are going to.
Actually, there are some things going around about that. So listen,
hopefully it changes for the better.
Yes. And Dr. Khan, you are such an angel to the BII community, and there's so many women here saying the same thing, and we so appreciate you, and you're so generous with your time and so much wonderful knowledge, and you are going to be saving so many women just watching this video. So please let us know if you're watching the replay or if you saw it live. And I promise to put this on the YouTube channel, and I'll share it to Dr. Khan so he can put it on his YouTube channel. And I'm sure we're going to have more lives with Dr. Khan. So if you have questions, save them. You're amazing, Dr. Khan. Bless you, bless you, bless you. And we so appreciate you. You have a great night. And ladies, thank you for watching.
Sure. Can I just say this to everyone?
Absolutely. Everyone? Michigan. He's in Michigan.
Yes. I say this to everyone. I said, you know what?
You're cutting out. I got you.
Yes.
I got you.
Can you hear me?
Now I
Yes.
can.
So I just want, yeah, I want to say, if everyone starts talking, everyone starts complaining and saying, these are my signs, symptoms, I will tell you, we, the medical community, the physicians, the plastic surgeons, are listening. My society is very professional, very honorable in a sense that we listen, and if you make the appropriate, just like Jewel was taken off, the e-cigarettes, were taken off. We just need to make enough noise. We need to get some more data. We need to have more women talk and come out and say, just so
This
that,
is a big
yeah,
deal. This is a big deal. Yeah.
I was removing the implant on a lady, and the anesthesia team member was looking over and saying, "What is that?" And I said, "This is what happens when you put in an implant." And she had a mastectomy, and she saw the
Implants.
whole thing. And I said, "Yes." And I said, "Go
Poor
and
thing.
look and do some research." And you know what she told me? I'm never going to put in an implant. And I said, you know what? One more implant prevented, because she at least was an educated, informed patient. Now, believe it or not, there are young patients that still say, you know what, I'm willing to take the risk
I know.
because, and you know what, it is, I
That's what
say to
being
the
young and
patients,
dumb is all about.
this is, at the end of the day, I say this, we all are smart. The patients are smart. We know, so the patients can make an informed decision. People, I had a University of Michigan student.
Infertility is a huge thing I see with breast implant illness women. So if you're watching this and you're thinking, I'm still going to do it, also decide whether or not you think that means you're going to have babies or not, because it could greatly affect whether or not you have babies. And that's something that would have swayed me.
So can I say one thing? You mentioned something now, as a physician, as an MD, I always say, let's see what's the proof. What is
Sure.
the studies? Now, there was a study that was done out of MD Anderson, 100,000 patients, 80,000 of which had silicone implants, 20,000. Now, was published in the Annals of Surgery, and 100,000 patients. Now, this was a study of the studies. So basically, it was not one study looking at 100, but they looked at so many different studies. And then they did an analysis, and they said that breast implants, silicone, were affiliated and associated with stillbirths. But this
That's
is,
heartbreaking. I think a stillbirth is even worse than a miscarriage, because now
yes, yes.
you went through all that time and then this sweet baby. What a heartbreak.
Right. And so I say to you, that was a very interesting and objective finding, by the way, which is published. And the point I'm trying to make here is what you said, there needs to be more research, because this is, again, all autoimmune driven.
Sure. And
And I will tell you,
the heavy metals. And I have to say, I have a lot of women in my group that have had mastectomies because of cancer, and they have implants, and now they're sick again after beating cancer after such an amazing feat. Now they're sick with BII, and all of these things, they just hurt my heart. And, as you imagine, these things keep me up at night, which is why I do all of this stuff, so that I can spread all of the love, and so that, wonderful
yes.
angels
So,
like you can help with all of this.
yes. So one last thing I just wanted to say is, please share your experience.
And share this
And
video.
take, and if you feel uncomfortable, that's your right, that's your respect, that's your honor, absolutely. But I say, if you write one line, if you write and post a YouTube video how you felt afterwards,
Sure.
or more importantly, I want you to critique, write, and grade, just like you have a check and balance on me. And I tell all my patients, write about your experience, write about, so that the next
Sure.
lady knows what she's going to get,
Or
what it
share
needs
other
to be.
people's experiences. Share
Yes,
them
yes.
all. I mean, there's just, the more sharing, the better. All right,
Yeah.
Dr. Khan, I see we lost you again, but we do have to
This is
sign
the
off
light
here.
sensor again. Okay, yeah,
Okay, we
okay.
do have to sign off now, and I have to
Sure.
put little babies to bed. But we so
Okay.
appreciate your time, and I'm so glad none of them busted in. We have a whole zoo here too. So, okay, yes. All right, thank you, ladies, so much for watching. Dr. Khan, you're amazing, and we're gonna have to, of course, do another Q&A with you. And I hope you guys all have a wonderful night. Share the video, share it with people that need to hear it, and you guys are awesome. Bye, Dr. Khan.
All right. Thank you very much. Thank you, Darby. Thank you, everyone. And please pass the message on, like Darby.
That's right. Good night.
Thank you. Bye-bye.